please describe your role as a clinical education coordinator?
I work at the Princess Alexandra Hospital in Brisbane, which is a very large acute hospital. I help coordinate the physiotherapy student placements. And just to give you an idea of the volume of student placements, last year, it's 2013 I should say, we've had over 180 physiotherapy student placements. My role is basically to support the placements, to make sure that the placements run smoothly. So I support the educator, help them out if they're in difficulty. If they're having challenging students, I can go and give them a bit of advice. If the educator's having a big group of students and is struggling with time, I can go and support them, whatever they need basically to make the role or their role easier. I also support the students. Because I'm not involved in their assessment, I can sort of be treated sort of like an outsider to them and support them during their placement. I become a link to the university, and also I basically support everything that needs to happen to make the placements run as smoothly as possible.
With that number of students going through, you must have seen and helped facilitate a lot of difficult situations. Would you please tell us what are the main reasons that difficulties arise in the clinical placement?
There can be a few, but often we find there's often some sort of external factor happening. So it might be something in their personal life, whether it be financial, a family tragedy, stressful situation, or it could be a medical issue, but some sort of external factors happening which is affecting their performance, and it often can manifest as a student not coping or the student struggling to pass the unit. Other things is if communication isn't working, if the effective communication isn't happening between the educator and the student, that's when there can be a problem. And I suppose it's planning. If a placement hasn't been planned effectively, then sometimes we find that we can have a problem at the placement.
Julie, not all workplaces are fortunate to have a clinical education support coordinator. What strategies can you suggest that a clinical educator who interacts directly with the student could use to help facilitate some difficult situations?
I think one of the most important things is to identify the problem early and address it as early as possible. The longer you leave it, the harder it is. And then of course, the other thing, like with most things, is having effective or good communication. If you can't communicate well with a student, I don't think you'll get very far. So I think they're the most important things, to get onto it early and really talk well with the student so that you can plan some strategies and resolve the issue as early as possible.